Much for waking up early to make this show.
All the way from Kwakwa. Let it be known. Let the record show, my lord.
This is love.
Absolutely.
Absolutely. So, Dr. Tlaleng, you've always been a big advocate of universal healthcare. Please walk us through why universal healthcare versus privatization of health. Why is this important for us?
So the central theme of the right to dignity is very important because that is something that belongs to all of us by just purely being human, right? We have an inherent right to a dignified life. And through, of course, my own career of being a medical doctor, I know how important access to health services are and how when medics, no matter which health and care provider category you fall in, when we understand human rights, we can actually, in our everyday mundane work, support the realization of dignity. So universal health coverage is important as a concept because it means whoever you are, wherever you are, you should be able to access affordable, acceptable, quality healthcare that then assists you to get that dignity. And it's not dependent on your age, your gender, your geographical location, your migration status, or even disability, for example. All of these are rights that are inherent to all of us because we are human. And so for me, universal health coverage as a concept is very important to protect as a public good, not as something that only a few can afford because of economic, privilege.
Okay, so how would you, we've been talking about NHIF, for instance, in South Africa. How would you have it working for us? There have been some disagreements with certain parties and on how to do it. What would you suggest if you were the advisor to, say the president or, and you really should be?
Well, if he's listening. So the issue, I think, for South Africa specifically, it's looking at historic reasons for the disadvantage, right? And for the disproportionate negative impact of health outcomes on certain communities. And then chart a way forward that has a vision, right? To firstly undo that historical reason for disadvantage, which is coloniality, which is apartheid, which is segregational planning, under-resourcing of particular services for specific communities. You can say Black communities in particular and poor people. And if we are going to undo that, it means our investment in health facilities, health systems, clinical care, underlying determinants of health has to be much more than just what happens in a consultation room, which means access to safe water, nutritious food, health environment. All of those rights are important because they directly impact our ability to stay healthy and well, but also to recover from disease and illness. Now, in South Africa's context with NHI, we need to ask ourselves, to what extent is NHI firstly going to undo historical disadvantage, but also propel us forward to a health system of a modern country and a modern society? The problem now that I have with NHI is that it's an administrative solution to an administrative problem that doesn't exist. The problems in this country are around infrastructure. They are around quality care, timeous access to care. And NHI in its current formulation does not address the fact that we need far more nurses and doctors than we currently have in the system. The NHI doesn't address the fact that we have currently unemployed doctors, right, who cannot be absorbed by the system. It actually creates more bottlenecks administratively to access. For example, right now, if you go to any clinic in Kwakwa, where I am from, you can get primary health care. Yes, the queues may be long. Yes, there's all of those things that we know, but you can get that access. With NHI, with having to then only go to a clinic demarcated by a particular physical address, having to prove that physical address, having to prove who I am by an identity document, creates bottlenecks which currently do not exist. So instead of solving a problem, we are going to create even more problems of access. Another interesting thing is that all of these systems are actually connected. If you think about having to prove that I am Tlaleng with an ID document, you have to ask how many South Africans currently have an ID document to prove they are firstly Tlaleng and secondly South African. And so we're already creating a problem even for South Africans who are in the rural areas, who are in the peri-urban centers, who have actually never had to have that proof. Many children now, because ID is now tied to a matric certificate, are then being forced to, right, through the Home Affairs system to get identity documents. But you have many South Africans who don't have such. And so it's not even about, limiting access to migrant population or undocumented people. That kind of over-policing of access to services is going to have a detrimental effect even for South Africans.
Absolutely. Now, how did a girl from the former homeland of Qwaqwa end up like becoming a doctor? Not just a doctor, but rapporteur for the right to health for the United Nations. Your journey, what led you there? What was it? In Qwaqwa generally, you had teachers, training colleges, and there you went.
Nursing colleges. We had, in fact, Qwaqwa historically is known as, and why it's called Putadichaba in Sesotho. That name means, a collection of nations. So it's actually maybe was in my stars, right, to be at the United Nations in that global space from Putadichaba, and it was really that way because of my grandparents, my great grandparents, of course, experienced land dispossession from their farms in every field actually, and so relocated under the Segregation Act in apartheid times to what we now call Qwaqwa. And I grew up, I suppose, very aware that there was something very abnormal about the space, the physical space of where I'm at. And this is not about my family or community. It was more about the space. I knew there was something just not okay. I was very aware as well and very annoyed. I remember, I think I was probably 8 or maybe 9, looking at a helicopter dropping toothbrushes and toothpaste into my schoolyard, my primary schoolyard. And I remember the blue logo. It could have been a WHO, could have been UNICEF, it could have been a UN helicopter. And thinking, even as a child, firstly, who said I don't have toothpaste? And secondly, why can't you drop the toothpaste in the school properly?
In my hands.
You understand? Like, what is going on in this society, in this community, that toothbrushes have to be dropped by a helicopter into the schoolyard, like a consignment in a box? And I think it's those questions, even though I was a child, I didn't have the answers. I don't even think I articulated the questions. There were just questions bubbling under within me to say, what's going on with this? And I think it's that awareness, that I just carried with me, that even though maybe I didn't have the sophistication of, articulating them or even analyzing them, I just knew some things were just inherently wrong, even though they were normalized. I knew that it was not okay that only Black people are living in this space where we could hardly grow crops, by the way, because it's literally at the foothills of the mountains. Not much, can happen there. We dignified the space. Absolutely, we did. And it's still home. I still go back to Qwaqwa. It's still home. But how it got formed, and of course, later on, really reading the history of the place, a lot made sense. And I think my activism stems from that discomfort, right? That perpetual discomfort of something is just slightly off. Even though I may not necessarily be sophisticated in analyzing, but I know in my heart something off. And I think there is that determination to then make it right.
And that leads us to Palestine, because you have really been a big advocate for access to healthcare for the people of Palestine. And this has landed you in trouble, but at the United Nations by the wrong type of people. So tell us about that. What did you see as UN Special Rapporteur that led you to saying that there's something inherently wrong, there's something that demeans people in this particular situation?
And, this issue for me is not even an academic legal conversation. And even within the UN itself, at least in the 2-3 days after October the 7th, the conversations were about what is this that's going on, right? And it was clearly an escalation of violence that had already existed before October the 7th. It was given different names, different reasons, but for all of us who understand the battle and the fight for freedom of the occupied Palestinian territories, we knew that October the 7th was not the beginning of the problems. It was an escalation that had a particular nuance, but it was certainly not the beginning. And I say this because when I was growing up in that very Qwaqwa, at the peak of our anti-apartheid movement in South Africa, Nelson Mandela's name was banned. The only way our elders could teach me and others about our history and our freedom and our struggle for freedom in South Africa was through the Palestinian story. And why I say it's not a legal or academic conversation for me, even within the UN, is because I already brought that with me. Whether October the 7th happened or not, I was already committed to the struggle of Palestinian people because I understood the intrinsicness of our battles. And so when I took on this mandate in 2020, again during COVID, one of the first things I did was to communicate to the government of Israel and reminding them under the right to health, their obligations as a member state of the UN around access to vaccinations, diagnostic, PPE, and food and nutrition and water for the occupied Palestinian territories. And so fast forward to October the 7th, we had been appealing on many occasions for medical evacuations, for them to allow children to be evacuated with their family members, because often they would decline and say only the child can go, you know. So we were
going to look after the child.
Precisely. And we were in a continuous cycle of urgent appeals, allegation letters, all sorts of formal communications within the UN, while at the same time supplementing that with public advocacy, because first and foremost, our lives are political. Health is political. And so when October the 7th happened for me, it was not something that I had to think about or something that someone had to make me conscious about. It was, oh my gosh, the worst of what we have already been feared is coming to fruition. That's why it was easy for me to call it a genocide way before anyone else did, and finding resistance both internally and outside, saying, why is it a genocide? I said, well, I grew up in a town, right, called Kwadwa, that was literally designed for genocidal outcomes and capabilities. That the bombs did not rain on us in Kwadwa the way that they're coming down in Gaza is a miracle. But that the conditions created were always of segregation, apartheid, and making sure that there is no life. It's unlivable. There's no dignity in the space. For me, was exactly sort of like my childhood. Yeah.
We'll return with Dr. Tlaleng after an ad, because we need to pay the electricity and rand water. Well, Joburg water.
That comes from Sterfontein, by the way. Your Joburg water is there in Kwadwa, in the Sterfontein Dam.
Salam Media, your spiritual companion this Ramadan. You are listening to Salam Media live from our headquarters in South Africa. This is Salam Media, keeping you company this Ramadan.
I am back with Dr. Tlaleng Mofokeng, Rapporteur for the United Nations Right to Health. Dr. Tlaleng, you 3 years after you graduated, one of the things that you have observed, obviously, in particularly with Palestine, is the organ farming of Palestinian bodies, kidneys, eyes, etc., for Israel. 3 years after you graduated, we had the same situation happening at Durbanville Netcare, and the body parts were going to Israelis. How far is Israel from us? How far is Zionism from us?
Unfortunately, it's very much with us. And I always tell and remind people that even the South African Apartheid National Defense Force used to train with Israel Defense Force. They used to develop weapons together. And they used to test it on our black bodies in the townships in these Bantustans, right? And I often appeal to South Africans to really be awake to that reality, that what is happening in the occupied Palestinian territories, especially Gaza now, is something that is an extension of a project that was decades long. And the South Africa one was disrupted by particular, pressures around economic boycotts and sanctioning of the apartheid government, and also that through the South Africa story.
Sorry, take us back. I think we lost you.
Okay. Yeah. So the South African Apartheid Defense Force used to train together with the Israel Defense Force. Mm-hmm. And during the apartheid times, they used to not only just develop weapons, but they used to test them on the black bodies in the townships in these Bantustans. But they also used to develop surveillance methods that were also tested on all of us. And so we are not disconnected from the historical but ongoing struggles that the Palestinians are experiencing. I was actually in medical school in Durban when the scandal of our professors broke through, in that they were involved in some form of organ trafficking and using a private hospital in Durban to do this while they were teaching us. And we actually wrote our final surgical exams without our internal surgeons there, because then they were under investigation.
Oh, wow.
So, for some of us, the issues we deal with are visceral. They are real life things. We've experienced them, we've gone through them. And now fast forward to a lot of the testimony that's coming out through this particular escalation after October the 7th, that indeed many of the prisoners that are in Israeli prisons are having their organs stolen. Many of the bodies are returning with missing organs, and many more people are unaccounted for. And the fear is that there is this underbelly of organ trafficking, stealing of organs and bodies of people. And why I always talk about dignity is that I don't just advocate for dignity in living. I also advocate for dignity in dying, but also for those who are also dead. And one of the big things I was already speaking about after October the 7th was the manner in which even the martyrs were being treated, right? Was the manner in which people could not culturally perform their rites, right? And the ways in which, I'm actually getting goosebumps, the ways in which martyrs were then having to be respected and given dignity, just even on the side of the road with whatever little soil was there in Gaza, because it was actively being destroyed, while people were also actively trying to find dignity, even in death, even in those situations. And in my previous life, I always thought I would be a forensic medical doctor, because I'm also just fascinated about this idea of giving dignity back to people who have died, through telling their story, through finding, their identities. Some of them, are not known, like our fellow Palestinian martyrs and some prisoners now, who families had to find bodies and go through hundreds of bodies in the hope of identifying their loved ones, because even in the ways that they are preserved has no dignity. The way that the Israel government treats them, even in death, has no dignity. And so there's something important about just understanding that all of this is for our dignity, both in life but also in death.
Yeah, and of course, the organ trafficking is something that we're also seeing. There was a documentary in Kenya as well. So, and again, it's going to the usual suspect, Israel.
That you can trace it all back to the same route, no matter how long and how convoluted the mapping looks, but it ultimately boils back to that. And I think, there's something about people who see themselves as privileged, who see themselves as particularly better than other people, that they must live, they must have, and they have a right to. And the same way that they destroy the lands, indigenous lands, it's the same way they destroy the indigenous bodies, The same disrespect they show to the olive trees, to the water salination plants, the same disrespect, the disrespect they show. So in a metaphorical way, those lands, the physical land also demonstrates the physical land, which is our bodies. And I don't see how the same people who perpetuate those kinds of crimes on crops, on lands, on indigenous lands, and cultural references could suddenly find humanity and a dignified way to treat the very people who inhabit those lands.
And yet in all this, an organization which should have been proscribed after apartheid, as far as I'm concerned, an organization that celebrated Percy Yutar, who was the prosecutor for Nelson Mandela, South African Zionist Federation, reported you to the Health Professions Council of South Africa for a personal tweet. When do you stop being a doctor and when do you start being Tlaleng Mofokeng?
And also, I'm doing the work of being a UN Special Rapporteur. It's a political position. And because I'm a UN official, there are immunities and privileges that come with that work.
Absolutely.
That protects one from persecution, from harassment, intimidation. And I don't think any of us would have foresaw that they would use the domestic South African processes in this way for the work I do at the United Nations. That I'm South African is coincidental, right? And they are misusing that to punish, harass, intimidate, and to try and silence me on the work on, firstly, telling them that a genocide is incompatible with human rights, and diagnosing and actively writing reports on Israel and their alleged human rights violations. It's another extension of Zionism that seeks to wield its muscle and its power and its authority over everything and anyone. And for me, on that particular point, I was directly responding to and speaking directly to the work that I've always been doing as a UN Special Rapporteur, specifically around Gaza in this context of genocide. Nothing I said there is removed from that work. And so by coming after a UN official, using domestic means to do that, because according to them, the United Nations failed to do nothing to me, in inverted commas, whatever nothing is, tells you that their aim is to seek to punish, to make whatever point that they seek to make, which is why my resistance and my fighting back is not just only principled, but it must happen, because we cannot allow a situation where wanted war criminals are shielded, revered, and protected and celebrated, and the person who's angry that a possible ceasefire is being withheld and being stalled is the one now who gets prosecuted and persecuted. And so for me, it's fundamental, beyond even just freedom of speech and all of those things, it's fundamentally that we cannot allow Zionism and Zionists to threaten any of us. Even if they think they have won, it's still a problem, right? So we must summon the necessary fight and stand up to that intimidation. And if they can do it to a UN official using domestic means, it's problematic. It's very problematic.
Dr. Tlaleng, we are out of time, unfortunately, and Dr. Alan Bosak is on standby. But I wanted to let everybody know Dr. Tlaleng is also an award-winning author, and she has written Dr. T, a guide to sexual health, which was a bestseller. Where can we find it?
So Take A Lot is very good and they deliver very quickly, but you can also find me at Dr. Tlaleng on Instagram, on Twitter for signed copies and all of the like.
And maybe as we wrap up, you can just tell us about the film, which I managed to see a teaser of, that you are part producer on.
Yes, so I'm executive producing a couple of films. One is centered around gender-based violence. It's called Saint X. The other one is looking at advocacy and feminism around women in general in South Africa. And then a romantic comedy, hopefully, that the script will be finished in the coming year or so. So a lot of work to look forward to after my tenure at the UN also comes to an end in July.
Thank you so much, Dr. Tlaleng Mofokeng, UN Special Rapporteur on the Right to Health, author and producer.
Yay!
Looking forward to chatting to you in future.